Uveitis is an unusual condition where you get inflammation within your eye. It can either be the front of the eye, the iris, or the back of the eye, in which case we call it posterior uveitis. If you can imagine, you can get inflammation within a joint. You can also get inflammation within the eye. Quite often your GP, you will have been to see your GP, and your GP will have given you some antibiotics because he thinks you have an infection. With an infection, you get pus coming from the eye, whereas with uveitis, you don't have any pus and your eye will become red. What are the causes of uveitis? Well, in most cases, in fact 80% of cases, there is no other cause. We call this idiopathic, no other cause. In only 20% do we have some systemic condition within your body. For example, it could be the skin, it could be the lungs, it could be the joints, it could even be the bowel or the urinary tract, or even past infections a long time ago that you had in your childhood. One in particular you may have heard about called Lyme disease, which is from tick bites. So uveitis is not very common, and when we see you, we often ask about previous conditions you have, or we ask about joint pains or skin pains, skin problems. For example, there's a condition called sarcoidosis and another condition called ankylosing spondylitis, which is associated commonly with uveitis.